Sir, one of the things that I'm very curious about is how your group of extraordinary people deals and how you've dealt with parents on a large level and telling them you have a very sick baby and here's what we're going to try to do. What's that like?
I think it is a very, very unique moment because you have the opportunity to touch someone's life. I mean, the entire life of that person, that child and that family. And when we deal with a lot of operations and a lot of multiple patients, we have to focus each time with each individual situation that you're talking to that one human being, and that is the entire life for that human being and that family. So I think it's extremely important to explain extremely well what the malformation is all about, what the surgical options are, what the risks are. In many areas in congenital heart surgery, after all these tremendous advances we've had, there are a lot of fairly clear answers as to what is the predominant way to treat a certain malformation. But there are many areas still of controversy where there's 2 or 3 different ways of doing things, or 2 or 3 different surgical techniques, and we don't know the answer for sure which one is the best. It's extremely important, at least in my own practice, is to get over perhaps the temptation to push for an operation that might be more exotic and more interesting for the surgeon, more novel because he believes that it's the better operation, but maybe it's more risky. So it's important to explain these things to the families. If we explain things properly in plain language, people are fairly intelligent. We have to show also a lot of empathy. And we have to put ourselves, at least I try to put myself in their situation. And every single time I'm dealing with that kind of a situation, I ask myself internally, what would I want done for me if I'm the patient, for my child? This is very, very important. And sometimes because of these tremendous advances in technology and technical operations and very complex things that we can offer, it is possible that sometimes the surgeon may not intentionally, but unintentionally overlook that aspect. I will give you an example, and the example involves a very complex situation. I will not name a specific malformation, but a fairly complex and high-risk malformation where one of the possible options, certain parts of the world, in certain centers, it really say, this is too complicated. Yes, there may be a possible solution for it, but it is not inappropriate potentially to offer compassionate care.